We know that a temporary lower FODMAP diet heals leaky gut, reduces inflammation, and also reduces things like dysbiosis and small intestinal bacterial overgrowth, and therefore leads to improved tolerance. There is so much that can be done to improve leaky gut, to improve your gut health. All of this, I'm hoping, will be interpreted as really empowering information. And if not, please do so, because as someone who's had many of these issues we'll discuss here in a second, I can tell you they're very, very able to be remedied. Okay, so let's jump in. Oh, and by the way, if you have not yet subscribed, please do so and also comment. That way you'll see future videos from us and I can look at the comments and see what you guys care about and give me ideas for future videos. Okay, now regarding the symptoms, it's helpful to zoom out and think of these in two buckets. One, the obvious digestive symptoms. Two would be more so systemic or inflammatory. So let's start with the digestive symptoms. Gas, abdominal pain, and bloating as one sort of cluster that often occurs together. So either IBS or IBD encapsulate altered bowels, constipation, diarrhea, abdominal pain, gas, bloating, discomfort. And what tends to happen in situations like this is there's this sort of web, this interconnected web, where when there's leaky gut, there's inflammation. Inflammation is unhospitable to healthy bacteria. And then you have the formation of imbalances in the bacteria, whether that be dysbiosis or bacterial overgrowth. When this occurs, you can have excessive fermentation. So skews in the bacteria can lead to the bacteria over-fermenting food. That causes increased gas, increased pressure and pain, but also the inflammation that accompanies all of this makes someone more sensitive to gas and pressure. So within that, we mentioned briefly constipation and diarrhea. So this would be another one. It has been demonstrated that the inflammation occurring in leaky gut can alter your motility. In fact, a study found that there was increased zonulin, so a marker of leaky gut, in those with either IBS constipative type or IBS diarrheal type. So IBS, this abdominal discomfort, gas, and pain, can also occur with constipation or with diarrhea. So it can be labeled as IBS constipative, IBS diarrheal. Both of these were found to correlate with elevated levels of serum zonulin. So we've touched on constipation, diarrhea, gas, bloating, pain, pressure. Along with this, indigestion. This is more so kind of in the upper GI. You eat a meal, you feel prolonged fullness, maybe some reflux, warmth, GERD. And it has also been shown in models of indigestion that these patients have higher levels of small intestinal permeability or leaky gut. So probably not surprising that a number of digestive conditions correlate with leaky gut. This is a really easy one to sort of spot. If you have gut symptoms, you likely have leaky gut. But what about these systemic symptoms? This is where we start to get a better appreciation for the fact that 70% of your immune system actually resides in your small intestine. And because of that, because the immune system polices with inflammation, this is where we start seeing the systemic or broader effects of a leaky gut. So the first would take us all the way up to the brain. And there has been some pretty elegant research looking at the combination or the correlation rather between leaky gut, systemic inflammation, and what's known as sickness behavior. This is where you feel tired and kind of depressed. If you've had the cold or a flu, that feeling of, oh, I just need to hang out on the couch. I can't think, I don't want to think, I just want to sort of lay around. Well, this sickness behavior when you have a cold is normal. You can also have this, however, when you don't have a cold per se, but you're still having some of the inflammation and immune reactivity due to what's going on in the gut. With this sort of sickness behavior, I mentioned fatigue, and other studies have looked more directly at fatigue. A 2016 study in those with chronic fatigue did find that individuals had higher levels of, again, LPS, marker of leakage, and dysbiosis, an imbalance in the bacteria, than did their healthy controls. So probably not surprising. We're seeing with fatigue and with depression There's something going on in the gut, namely leaky gut, and this is leading to inflammation, and this inflammation can have a systemic effect. This is a good sort of springboard into another one of the symptoms that tends to accompany this cluster of fatigue and depression, which is also brain fog. So brain fog is I have a hard time thinking, I have a poor memory, I have a poor recall, I have poor mental endurance. What can happen in brain fog, or one of the mechanisms, is leaky gut leads to systemic inflammation, and it leads to inflammation in the brain, where specifically, but not limited to, these cells in the brain, immune cells known as microglia, are overactivated. Now, I just want to be careful to say, as someone who had food reactive brain fog due to my gut being a mess many years ago, this is very, very able to be remedied. I want to keep sort of hitting that point that all of this should be used constructively and in an empowering fashion, because there's so much that you can do to improve your gut health. Now, along with all this, people may experience joint pain. Again, if you're having joint pain, you may even have noticed certain foods perhaps trigger your joint pain. So this would be very demonstrative of there being leaky gut present. Now, as someone who has had poor sleep myself, I wanted to make sure to touch on poor sleep. Now, we don't have research looking directly at measurements of leaky gut and poor sleep, but we do have research looking at IBS, irritable bowel syndrome. And we already discussed the correlation between IBS and leaky gut. So the data here are showing correlations between IBS and poor sleep or insomnia. In fact, a meta-analysis of 36 trials did find that 38% of those with IBS have problems with sleep. Certainly something to think about. Now, there's other obvious things not to overlook regarding your sleep. Your pre-bed routine, aka sleep hygiene, and also timing of caffeine, making sure you're not consuming caffeine too late in the day, just to name two, but two fairly important factors for sleep. Weight gain. There's some evidence here. I don't know how strong this case is, but at least the research community is starting to show correlations between obesity, weight gain, and what's going on with gut permeability. And to quote a 2021 review paper, disrupted gut permeability, leaky gut syndrome, can represent a predisposing or aggravating condition in obesity. The final point I wanted to make here were for allergic conditions. So this would be food allergy, eczema, or other skin diseases like rosacea. And there's varying levels of evidence connecting these skin conditions and these allergic conditions to leaky gut. Just to quote one paper, zonulin and LPS levels were significantly higher in children with food allergy. Zooming out again, we have a number of digestive symptoms and we have a number of systemic symptoms, because what's going on in the gut will cause local symptoms, but due to the fact that 70% of your immune system's in your small intestine, and this impacts systemic inflammation, you might also see problems with mood, problems with memory, problems with sleep, problems with your joints, skin, maybe even metabolic, and certainly allergic and immune. The first thing I'd want to share with you, make you aware of regarding a pearl for leaky gut would be determining your gut type. I think of this as there being three different gut types: bacterial, fungal, and immune. Now, regarding a bacterial type gut, this is your classic SIBO, small intestinal bacterial overgrowth, IBS type individual. And they'll notice that especially higher fiber, lots of vegetables, tends to flare them. And these are the people who will say, the better I eat, the worse I feel. I thought I was doing so good. I had a big salad. I had a bunch of broccoli, whatever it is, right? Your typical sort of diet dictates lots of fruits and vegetables tend to flare these people. This is because there's either an overgrowth of bacteria, or it could be a disruption between the gut and the brain. But irrespective of how we define it, what you do to improve it stays the same. One of the things that you can do to improve it, given, if this is a bacterial type gut, would be a low FODMAP diet. And a low FODMAP diet is by design going to reduce the amount of prebiotics, the substrate that feeds bacteria. And the most important thing here is that low FODMAP diet clinical trials have shown impressive efficacy, not only for rectifying the symptoms that are very troublesome, obviously, gas, bloating, abdominal pain, loose bowels, but also to reduce leaky gut, to be pro-motility, to rectify dysbiosis, or to lower gas levels. So this is the one gut type, the bacterial type. What's interesting is that the fungal type is sort of the mirror opposite. The fungal types will generally do well on this higher vegetable, higher fiber sort of diet. They may gravitate toward a paleo diet, let's say, and they thrive on that, whereas the bacterial types won't. Now, here's an interesting sort of connection. If you've ever done a SIBO breath test, some people will remark, I felt great when I was doing the preparation diet for the test, which is essentially white rice and meat. That's the bacterial type. They may do well on that sort of higher starch diet. This will flare the fungal types. And this is because fungus feed on starches and simple sugars like sugary fruits. So think white rice, white potato, bananas, mangoes. These are not good for fungal types. However, they do well on, again, sort of your lower carb paleo sort of approach where they're eating salads and broccoli and asparagus, berries, but they're wary of things like white rice, white potato, breads, especially white breads, even if they're gluten-free, and higher sugar fruits. Hopefully this gives you some attunements and there's a few light bulbs going on in terms of if you have a bacterial type gut and you eat foods that feed bacteria, you'll oftentimes provocate your symptoms. And conversely, if you have a fungal type gut or candida and you eat foods that feed the candida, higher starch, higher sugar, you will likely flare your gut. Just as one data point here, we have discussed this on the show in the past to sort of add to the data regarding the randomized clinical trials for the low FODMAP. What about a candida diet? Well, one study found that compared to nystatin, antifungal medication alone, if you paired that with diet, you literally doubled the efficacy of candida clearance from 42% to 85%. Diet plays a big, big part of this picture, whether it's bacterial or it's fungal. Okay, so let me come to the immune type. Think bacteria and fungus on one layer. And underneath that, for some people, can be another layer of the immune system. These individuals tend to have symptoms as follows. They're a little bit more allergy prone, whether it's seasonal allergies, allergies to cats, dogs. They may notice a degree of supplement reactivity, other environmental reactivity like mold, some other symptoms, maybe a running nose, flushing, lightheadedness, depression, insomnia, palpitations, skin reactions, especially hives, looser bowels. These all, to some extent, indicate high levels of histamine. Now, you've probably heard of histamine. If you have allergies, you can take an antihistamine, Claritin, Benadryl, famotidine, loratadine, or natural agents like quercetin, resveratrol, and vitamin C. And what's happening here is when the body is reacting to something with the immune system, an immune reaction, histamine is a mediator of this. This is why antihistamines work to reduce symptoms. However, you can also overeat dietary histamine because there's a variability in histamine content of different foods. Some foods are very rich and high in histamine, and that will flare an immune type gut, whereas other foods are lower in histamine. Have you noticed you don't do well with fermented foods? Or have you also noticed that things like spinach, avocado, canned meats, jerky, or food that's been left in the fridge for a few days tend to flare you? All of these things paint a collective picture that histamine intolerance could be part of the problem. With all of these diets, they tend to be reparative. Any diet that's helpful tends to be reparative. That's also been shown, at least in 2 clinical trials, using a low histamine diet. They've even shown in one of these trials that when undergoing a low histamine diet, you actually produce more of the enzyme that digests histamine, DAO, diamine oxidase. And this is probably because you're allowing the intestinal tract not to have so much of an inflammatory response. Tissues heal, and the tissues in the lining of the intestine are where that DAO enzyme is produced. I wanted to share with you a breakdown of the histamine content of different foods. So what you're seeing here is the amount of histamine that was produced by using a supplemental probiotic, and it was negligible. Now we can compare that to the amount of histamine contained in some common fermented foods. You'll see that kefir is actually the lowest in histamine. So if you're someone who is suspecting that you might be histamine sensitive, kefir is probably going to be the best fermented food. And bear in mind, it's also, most kefirs are also lactose free. And then you start seeing progressively more histamine in yogurt and sauerkraut, and then much more in kimchi. Conversely, remember that we've discussed that kimchi is actually probably the richest source of probiotics, but that may come with some strings attached, which is a higher level of histamine in that food. That's pearl number one. These three gut types: bacterial, pair that with a low FODMAP diet; fungal, pair that with a candida diet or a lower carb diet, does not need to be keto per se, or immune, and pair that with a low histamine diet. Always remembering that you should be able to improve food tolerance over time. Let's start with an obvious avoid, or at least reduce, which would be alcohol. The better you're feeling, the healthier you are, the less symptoms, especially digestive symptoms, that you have, the more alcohol you can get away with. And I think 2 to 3 drinks per week is probably reasonable. The more you're currently in the throes of not feeling well, that's where I'd be more judicious with alcohol. I never want to paint any of these things as extreme, because this can foster undue stress. So if you do find yourself out and you are having a glass of wine, and a healthcare educator has been very overzealous about the messaging, don't ever have any alcohol, what that could do is start this cascade of worry and fear, which in and of itself is detrimental to health and healing. So I don't think we have a very clear answer on alcohol. Again, the worse you're feeling, the more I would abstain. And I would never, or I'd really try to avoid routinely going above 7 drinks per week, and perhaps 2 to 3 drinks per week is reasonable. The other food that's a fairly obvious don't consume, or at least generally avoid, would be UPFs, or ultra processed food. And these are foods that have been highly modified so as to increase the shelf life and the palatability. And I thought Kevin Whelan at King's College said it well, quoting, "Food additives are added to many UPFs, ultra-processed foods, and have themselves been shown to affect gut health. Evidence shows that some emulsifiers, sweeteners, colors, microparticles, and nanoparticles have effects on the gut microbiome, intestinal permeability, and intestinal inflammation." So because of this, we want to avoid ultra-processed or processed, moderate to highly processed meats and carbohydrates. So for meats, this would be anything salted, smoked, cured, dried, or canned. And in part, this is due to the nitrates, and the nitrosamines those lead to, which also occur in vegetables, by the way. Hot dogs, bacon, sausage, deli meats, these are things that I wouldn't make dietary staples. I wouldn't advise to have bacon or sausage every day. Could you? Yes. I think it would be better to make that a more of a once in a while sort of thing. Maybe bacon once per week, maybe twice, maybe some sort of sausage once or twice per week. But these things can add up pretty quickly. If you're having a processed breakfast sausage every morning, and then at lunch you're having, let's say, deli turkey, this is just accruing more and more processed foods in your diet. And with the carbohydrates, they are fairly laden with emulsifiers, colors, and sweeteners. So think sweets, sugary drinks, sodas, fast foods, potato chips. Now, whole potatoes would be different than potato chips. So again, it's not to say you can never have any of these, but these are things that you want to be judicious with. And you can certainly have, let's say, pork, but consider pork loin that you cook at home or a pork chop, things that haven't been processed so as to increase their shelf life. Another food to put on your radar would be non-organic foods. Let me lead by saying I don't think everyone needs to be eating all organic all the time. I think that's too high of a bar for many people. There are no human studies directly assessing leaky gut and the impact of non-organic foods on leaky gut. However, there is a 2014 meta-analysis that did find that organic foods contain more polyphenols, which are antioxidants, that have been shown to reduce leaky gut. So think about it this way. We should favor conventional whole foods over organic processed foods, meaning conventionally raised chicken breast over organic chicken nuggets. And that's a simple framework I would apply and do the best that you can. I wouldn't say this is a make or break, but this is one thing that if you can do this as you're able, will at least give you a little bump, if for no other reason than the richer polyphenol content. And that brings us to polyphenols more squarely. Again, these are antioxidants in plant foods that give them color, but they also protect the plant. And this is part of the reason why you may have heard the axiom of eating the rainbow. Various colors will have, of plants that is, will have different polyphenol content. So this is why not just having greens, but having reds and oranges and purples in your diet is a good strategy. Moving on to one of the foods that can go either way for people, and this is fermented foods. Fermented foods, as you may know, are rich in probiotics due to the live cultures they contain. One case in point, 2020 clinical trial using kefir, fermented dairy, 1 cup per day for 3 weeks. Quoting the findings, our study is the first showing that kefir supplementation causes an improvement in serum zonulin levels. 2 other randomized control trials examined kimchi or sauerkraut and found that 1 to 2 cups of these per day for 2 to 3 months improved the symptoms of IBS, constipation, diarrhea, distension, abdominal pain. So there's certainly a case to be made, and I've said before, that including fermented foods in your diet to obtain probiotics is a great and evidence-based health practice. And I just wanted to juxtapose the probiotic content here. You'll see that there's a pretty similar amount of probiotic in a supplemental probiotic as compared to sauerkraut, yogurt, kefir, and kimchi. Kimchi gets you a higher dose of probiotics, like I said earlier, but all of these are suitable approaches to obtain probiotics. If, again, you do suspect you're histamine sensitive, I would opt for either a probiotic or the kefir. And if you don't suspect that you are, then there's nothing here to worry about. The next food or type of food to consider would be foods that are glutamine and collagen rich. And this is because glutamine is a very crucial amino acid and very abundant amino acid in the lining of the gut. And the best evidence point for this was Kiki Zhao, who's over at Tulane University, and we're hoping to have a conversation with her on the podcast in the near future. 2019 clinical trial. She administered, admittedly, a high dose of glutamine, 15 grams per day, which you won't be able to get from food. You will need to supplement in order to hit that. But she demonstrated a normalization of a different test for leaky gut, the lactulose mannitol ratio test, and an 80% improvement in IBS symptoms. So beef, chicken, lean meats, eggs, and bone broth are just some glutamine-rich sources to consider including in your diet. And again, this is because that amino acid will help with repair of the lining of the gut. Similar but different, omega-3s, you've likely heard of fish oil because it's anti-inflammatory. A 2016 observational study did find that increased omega-3 fatty acid intake correlated with lower levels of zonulin in women. So opting for fatty fish like salmon, mackerel, tuna, sardines, or nuts and seeds, flax, chia, and walnuts, and targeting to eat 2 servings of fatty fish per week or 1 serving per day of nuts and seeds. And this dovetails nicely in the theme of anti-inflammatory to certain herbs and spices. Turmeric or curcumin is a Indian spice. There's one pretty interesting randomized control trial from 2021. They administered 500 milligrams per day of curcumin as a supplement, after 2 months, they documented a 28% reduction in gastrointestinal symptoms, so pain, diarrhea, constipation, and indigestion. And get this, a 52% reduction in anxiety. And this is likely due to the gut-brain connection, partially mediated via inflammation. So the objective here would be 1 to 2 tablespoons per day of turmeric or 500 milligrams per day of curcumin. A few others to consider would be peppermint and clove. Part of the reason for these is these are two of the richest spices regarding polyphenol content. And additionally, ginger, cinnamon, rosemary, and thyme. And these are things that you may just want to season your food with or do something like a ginger tea. A 2021 clinical trial put people on a low FODMAP diet for 3 months, and they found a decrease in multiple measures of leaky gut, LPS, and serum zonulin. Quoting, GI symptoms, psychological state, and QOL, or quality of life, significantly improved in these patients. Simultaneously, an improvement in small intestinal permeability and intestinal mucosa integrity occurred. So zooming out for a moment, you may have heard people say, well, people who go gluten-free see reductions in zonulin, reductions of leaky gut. Well, it might be, as this study is substantiating, the reduction in FODMAP. Why this matters is because FODMAP tolerance is able to be recovered. 50% of the high FODMAP foods that are cut out of the diet can later be reintroduced and tolerance can be recovered, because it could be that the FODMAPs are the problem. And again, we know that a temporary lower FODMAP diet heals leaky gut, reduces inflammation, and also reduces things like dysbiosis and small intestinal bacterial overgrowth, and therefore leads to improved tolerance. So if you did want to, let's say, go out and have that glass of wine and also maybe have a slice of pizza or a bowl of pasta or whatever it is, the odds are fairly likely that you will be able to do so. And why I care about this is because I would like for you to have the broadest diet and the most food freedom and not be falsely attributing your improvements on a gluten-free diet to lifelong need to avoid gluten due to the gliadin, but rather it may have been the FODMAPs again, which is recoverable. So hopefully that all makes sense. And moving on to the next food here, dairy, controversial. Lactose malabsorption prevalence in the US is about 42%, and the cow's milk or the casein allergy is anywhere between 1 to 4%. Think about that for a moment. The lactose, the sugar, the carbohydrate, 42% intolerance. In actual protein allergy, 1 to 5%. Now, remember that the other carbohydrates, the FODMAPs, tolerance there is recoverable. Well, same thing here. Meta-analyses have demonstrated that interventions that help heal the gut, namely probiotics, improve lactose tolerance. Now, why is this? Well, when the food reactivity is carbohydrate malabsorption, again, that is recoverable because as the intestinal tract heals, endogenous or your internal production of enzymes also tends to be improved. And that allows absorption and digestion of the carbohydrates that weren't able to be digested prior. Again, why all this matters is if you've had an experience of improvement when cutting out gluten or dairy, it's more likely that it's the carbohydrate malabsorption component that when you reduce those carbohydrates, you saw improvements that led to your improvements. And that is able to be improved. And it's much more rare, although it can happen, but it's more rare that you have a true inflammatory reaction to one of the antigenic proteins in these foods. How to supplement smartly. This is a little challenging because supplementation, I think, is best done in a personalized fashion where we have a hypothesis, we give someone a treatment plan, and then we see how they respond and we modify based upon their biofeedback. Nevertheless, I think there's a general approach that can guide you, and always check these things with your healthcare provider first, but 3 layers. First layer, the first few things to consider would be a probiotic supplement, because this supplement, probiotics, will help with the immune type. It's been shown in a number of trials that probiotic supplementation can reduce histamine levels and histamine-mediated symptoms. It can help with fungus. A number of clinical trials have found that probiotics are antifungal, anti-candidal, and can help with SIBO or IBS. So that's an easy one. I should share with you a 2023 meta-analysis from Frontiers in Immunology summarizing 26 randomized control trials in over 1,800 patients, and they found that probiotic supplementation led to improved leaky gut via a variety of markers, including serum or blood zonulin, LPS, and another test called the lactulose-mannitol ratio. Additionally, the probiotics improved dysbiosis, and they decreased inflammatory cytokines as C-reactive protein, TNF-alpha, and interleukin-6. Regarding how to use probiotics, we've discussed this before, but just in brief, you can organize probiotics into one of 3 formula types: blends of lactobacillus and bifidobacterium, looking at a dose of anywhere between 1 and 50 billion CFU per day, or conversely, a Saccharomyces either as cerevisiae or Boulardii, anywhere from 4 to 15 billion CFU per day. And then finally, the bacillus or soil-based probiotics at a dose of anywhere between 2 and 6 billion CFU per day. Now, to have the strongest probiotic, our hypothesis is you want to combine the 3 formula types together so as to have, we call it the triple therapy probiotic. Glutamine can complement this. The average diet contains about 3 to 6 grams of glutamine per day. So this is where supplementing with an additional 5 to 15 grams per day will get you into that therapeutic level, and why I say it's pretty challenging to get enough glutamine from diet alone. And this is where, at least early phase, if you're symptomatic, I think using a glutamine supplement makes sense. And also an elemental diet used not 2 weeks exclusively. If you go reading on the internet, you may hear it's got to be 2 weeks, so nothing but this sort of medical food meal replacement for 2 weeks. That is overkill. But how you could use it is as a reset. So this liquid meal replacement for a day or 2 or 3, maybe even 4 as a reset, and then from there, maybe replace 1 or 2 meals per day. The elemental diet does use maltodextrin, this easy to absorb carb source. And for those who are wondering if they're a fungal type, and if my claim is that starches and sugars are bad for this type, does that mean if you're a fungal type, you should not use an elemental diet? I don't think that's the case. Now, clinically, I haven't seen that. With any therapy, some people have a negative response. So we always want to factor that in. There have been 2 studies that found either a neutral effect of the elemental diet on intestinal candida or a benefit. And this might be because the elemental diet will absorb within the first 2 or 3 feet of the roughly 22 feet of small intestine. So the majority of the small intestine is able to have a break. The one exception for whom an elemental diet might not be a good fit is people with this sort of oral thrush or upper GI nasopharyngeal candida. And so in these cases, you may notice phlegm, mucus, runny nose, white tongue. And for those individuals, a elemental diet may not be a good fit. The second layer is either use of colostrum or immunoglobulins. Now, these are similar. Colostrum does contain immunoglobulins. A immunoglobulin supplement is just a concentrated version of the immunoglobulins, which are essentially the mucous membrane that coats your intestinal tract and prevents an immune and inflammatory response. The way I've made an analogy for the immunoglobulins is it's akin to taking a shard of glass and dipping that in wax so all the rough edges now can't cut you. That's sort of akin to what immunoglobulins do. They bind specifically to LPS or lipopolysaccharide fragments that can trigger the immune system. The reason why I may have a little bit of a bias toward immunoglobulins over colostrum, although they're both permissible, is the Leonard Weinstock study wherein, and this was in a non-blinded, non-placeboed fashion, so we want to be a little bit cautious, but the setup of this study was interesting in the sense that he gave immunoglobulins to individuals who did not respond to diet, to antibiotics like rifaximin, to antispasmodics, or to laxatives. And he documented an 85, if I'm remembering correctly, 85% response rate. Now, given there was no placebo, we probably want to cut that response rate about in half, but that's still a very favorable response rate. And then the third supplement to consider, and this would really be a number, would be some sort of either direct antimicrobial or antihistamine type support. And we've made this chart. It gets you in the proximity. Many of these natural compounds will be both antibacterial and antifungal at the same time, but this is how I would at least attempt to categorize these. For a bacterial type gut, oregano, peppermint, black walnut, olive leaf, and berberine are considerations. For a fungal type gut, garlic, by the way, one study did find similar effect on vaginal candida with a antifungal medication as compared to garlic at 500 milligrams dosed 3 times per day. So garlic is one. Artemisinin, or I would say more specifically Artemisia, which is the whole plant. Artemisinin is a isolate, and we'll be doing another follow-up piece on this that's going to be more expansive, but the long short is artemisinin can't be used long-term. There's a tolerance that builds up in the body to this, but, and this is what I love about herbal medicine, when you use the whole plant as Artemisia, that does not happen. And most of the research with wormwood, this is what this is derived from, Artemisia, is done in the model of malaria. It has been demonstrated similar efficacy to clear malaria when using the artemisinin isolate as compared to Artemisia, the whole plant, but the whole plant doesn't lead to this tolerance within the body. Coming back to fungus and candida, it's been shown that Artemisia will, for lack of a better term, sort of sever these filaments or hyphae that chronic candida can create that sort of anchors them into tissue and makes the candida or the fungus more resistant to treatment, which is why I'm progressively becoming a big fan of Artemisia. And also MCT oil. This has been shown in 1 or 2 trials to actually reduce intestinal fungus. It's a derivative of coconut, which is also antifungal. It's just going to be a little bit more concentrated. And then, as I mentioned a moment ago, for the immune types, there's a number of natural antihistamines, quercetin, vitamin C, resveratrol, N-acetylcysteine, and also the immunoglobulins. Do not overlook the importance of lifestyle. This would include time in nature and exercise. Moderate to vigorous exercise. So moderate would be brisk walking, jogging, hiking, or weightlifting, and vigorous would be sprinting, high-intensity training, or circuit training 3 to 5 times per week. And here's the key point: 60 minutes or less per session, because it has been demonstrated that habitually exercising for longer than 60 minutes can increase leaky gut. Regarding sleep, it has also been demonstrated that normal sleep increases the diversity or the health of the microbiota, and that poor sleep actually increases imbalances or what's known as dysbiosis. And there might even be what's known as a feed-forward effect here, where as sleep gets worse, the gut becomes less healthy, and then sleep becomes even worse. And just quoting, sleep disturbances is proposed to be linked with activation of the cortisol-producing HPA axis, altering gut bacterial composition, and reducing intestinal barrier function. The bacterial changes may stimulate pro-inflammatory cytokines that may further exacerbate sleep disturbances. So all this to say, it's really worthwhile paying attention to your sleep. And just in brief here, a few mainstays of healthy sleep would be maintaining a consistent time to bed and time to wake, eating and exercising earlier in the day, and this is something I've recently changed with notable benefit, in eating at or before 6 p.m., avoiding caffeine 12 hours before bed, so usually capping caffeine to about noontime, and avoiding bright light and stimulation 1 to 2 hours before bed. And then regarding stress, I did want to share with you what I found to be a really fascinating study that took a group of high stress subjects and compared them to low stress subjects. They tested their blood with LPS, or lipopolysaccharide, the component that leaks through when leaky gut is present. And they found that those with high stress had more of an inflammatory response to that LPS particle. So if you're under stress, this will likely make leaky gut worse. Now, there's good news in that simple techniques can mitigate stress, whether this be meditation or time in nature. 2 hours per week is a good mark regarding time in nature, or something like cognitive behavioral therapy. And we've been using at the clinic this app called Clarity. In case you didn't want to see a therapist, this is sort of a therapist in your pocket via the Clarity app. This is truly at the core of what we do. I absolutely love helping people improve their health in a one-on-one clinical setting. As someone who suffered a decent amount throughout my life with gut issues, I'm so passionate about helping you guys improve. And we are progressively developing. I mean, we're always tweaking and making better, but we have some quantifiable assessments paired with biomarkers or labs to assess bacterial type versus fungal type versus immune type, with corresponding dietary interventions and supplement protocols. So if this seems like a lot and you need some guidance, please reach out. Would be more than happy and honored to help you. Again, this really is at the center of what we do. And really, all of this is built upon, in part, my own suffering, and then wanting to help alleviate that suffering of other people. So if you need help, reach out to the clinic and we will be more than happy to help.